But that's way more than enough about me. I want to learn a little bit about some of you. By a show of hands, how many of you in the room this morning are somebody's boss? Okay, congratulations, you are the topic of dinner conversation at other people's houses. Not sure if you knew that or not. And as you may already know, being someone's boss means you possess a tremendous amount of power. And as we all learned in Spider-Man, with great power comes. I'd like to thank all of my pop culture folks for being here today. Thank you. You know, Voltaire doesn't get enough credit for that because he said it first. It is true. You possess a tremendous amount of power, and it also provides you with a tremendous amount of responsibility. And I would also argue, and the research bears this out, that you, each of you, who supervise others in healthcare, are the most important people in healthcare. It seems almost blasphemous not to say that it's patients. And please don't tell a room full of physicians that I said that. But it's true. We know that. The research bears it out. In fact, I want you to do something for me this morning. I want everybody to stand up, please. Go ahead, stand up. I want you to introduce yourself to the person next to you. Tell them your name and where you're from and what you do, and then say, I'm the most important person in healthcare. Okay? Go ahead. Felt good, right? Here's the problem. You don't believe it yet. Nope. You don't believe it yet. That's okay. I'd like to think that by the time we're done with our hour here this morning, that I will have proven it to you. It is true, though. The research bears it out. Here's what we know. Research tells us there are a handful of conditions that, when present in the workplace, lead employees to give their all, to care and to try, to go to work every day and have an emotional and psychological commitment to their work. Research also tells us that those conditions are largely created, installed, and maintained by you, by their boss. I said it's almost blasphemous that I didn't say patients are the most important. Of course, those are the folks that we are there to serve. Patients and families always come first, but we don't serve them well unless they encounter engaged, prepared teams. When they encounter folks who have that emotional and psychological commitment to their work, they have an outstanding patient experience most of the time. And we know that those engaged, prepared teams aren't built unless there is a frontline manager on site who knows how to create those conditions. And that is essentially what I'm here to talk with you about today. But there's a problem. And that is that we don't do a very good job equipping you, those of you especially who work on the front lines and supervise frontline healthcare teams, we don't do a very good job giving you the skills and tools that you need to tackle the problems that you face every day. Let me ask you, by a show of hands, how many of you during the 4 days you've been here at this conference, how many of you attended the session on how to deal with the MA who is so negative that she's crushing the morale of the rest of the team? A couple of folks got to have that conversation, yeah. Did you see a title or a session that was focused exclusively on that kind of an issue? I didn't. I know it comes up in some of the discussions that we're having, but there wasn't a session about that. Did you get to go to a session on how to navigate the gossip, the cliques, the infighting, the backbiting, the that's not my job that crops up from time to time? Anybody attend that session? It's because there wasn't a session like that, was there? Now, there are some great sessions here on the people management problems we face every day. All that stuff that I just mentioned, it's the interpersonal and performance management challenges that we face as leaders of teams. And they're not unique to healthcare. They're in every industry. But we don't do a really good job talking about that. I went to some great sessions while I was here. I heard a lot about data, heard a lot about systems integration, Heard a lot about provider productivity, right? Not a lot about those people management problems. There were some. Anybody go to Tracy Spears' session yesterday on Coach 'em Up or Coach 'em Out? Outstanding session. But an outlier. We need more sessions like that. That's the kind of stuff that I want to help you with. Now let me hear from you very quickly. I mentioned some people management problems, some of the interpersonal performance management issues. What are the people management problems you're facing in your sites right now? Just shout out some answers. Turnover. Unreliable people. One more time. Accountability. Unengaged. Absenteeism. Negativity.
Working in silos.
Working in silos. Entitlement. It feels good to get it out, folks. Just let it go. I told somebody that just yesterday that I may come back next year and do an entire session on smack roll side. Some of you have seen me speak before and know what that is. If you don't, watch closely. Tell me if you encounter this in the workplace. This is smack roll side. Anybody know that? What do you do with that?